Kelsey, and I'm a medic in the U.S. Army. I'm briefly just going to go over today how to do a casualty assessment. So, what that means basically is if something happens while you're on patrol or in garrison back on post, this is just how you're going to assess that casualty and get them taken care of, wrapped up as best as you can, and get them up to the higher echelon of care. So, a really common acronym that we use in the Army is MARCH. The MARCH sequence stands for massive hemorrhage, airway, respirations, circulation, and hypothermia. It's a mouthful. So, with massive hemorrhage, that basically means that any amputation, any big major bleed that you have on that person. So, about 20% of casualties, actually, battlefield fatalities, are caused from preventable occurrences where the casualty is bleeding out, hemorrhaging from the extremities. Number one, most preventable death. So with that massive hemorrhage, what you want to do is you want to get a tourniquet, gauze, anything like that, and you want to stop all those major bleeds first. After you get all of your blood figured out, make sure they're not bleeding, not losing any more blood, and move on to airway. So you want to make sure if your patient's unconscious, that you have an airway, that they're breathing, that there's nothing blocking or obstructing that airway. So you can do this with a head tilt chin lift. You're just going to pull up on their head and open up that airway. Make sure they're breathing and nothing's blocking the airway. For respirations, you're going to make sure that both sides of their lungs are rising and falling equally, bilaterally. Look, listen, and feel. Make sure that there's no problems, no unilateral rise and fall, just one side is falling, not the other. And then you're going to make sure that there's no gun wounds or gunshot wounds at all. So you would cover that with a dressing as well. You're moving on to circulation. Circulation is really important, especially if your patient has lost a lot of blood. So you want to make sure that they have bilateral, again, radial pulses right here in their wrist. So if they do not have radial pulses, you need to make sure that you're pushing fluid and getting them perfusing again as normal. And we move on to hypothermia. You want to make sure that your patient is wrapped up, kept warm, and make sure that if they've lost a lot of blood, they're not going to be perfusing that blood to all organs and limbs as they usually would. So you want to keep them wrapped up and warm. And then lastly, you want to make sure that you document everything that you've done. In the Army, if you don't document it, it didn't happen. So it's a really big risk that your patient could be facing if you send them on to someone else and you don't document something important. They might, give it to them again, and that could really harm your patients. I hope this was helpful and you learned something. Thanks.